Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is briefly made clear and often illustrated. Today's topic is intracranial hypertension. Intracranial pressure is the pressure exerted by the cerebrospinal fluid inside the skull and brain tissue. At rest, it is normally between 7 and 15 millimeters of mercury for a lying adult. Pressure changes are attributed to change in volume in one or more of the components of the skull. Cerebrospinal fluid pressure is influenced by sudden change in thoracic pressure during cough or Valsalva maneuver. Intracranial hypertension is a diagnosis and therapeutic emergency. Intracranial hypertension is a clinic syndrome reflecting the increase in volume of at least one of the three compartments: the cerebral parenchyma, tumor, proliferation, edema; the cerebral blood volume, hematoma, thrombophlebitis; the volume of the cerebral fluid itself, hydrocephalus. Symptom: frontal or occipital headache, increasing it is permanent and increasing in the morning and relieved by vomiting and increased by Valsalva. I repeat, the headache is frontal or occipital, is increased by Valsalva and relieved by vomiting. There are also dizziness and seizure. In addition to decreased visual acuity and diplopia, in the fundus exam, there is a papillary edema. The spontaneous evolution toward coma, and for the child under 3, increasing the cranial perimeter. But in older children, there are pseudo-digestive symptoms like false appendicitis. Morning headache, relieved by vomiting and increased by Valsalva. Seizure, diplopia, and decrease in visual acuity, and edema papilla in the fundus. Baby before 3, increase in the perimeter of the head. After 3, there is some pseudo-appendicitis. Increased intracranial pressure, Cushing triad. 3 symptoms: increase in systolic blood pressure, decrease of pulse, and decrease of respiration. Cushing triad is the opposite of shock: decreased systolic blood pressure, increased pulse, increased respiration. Increase intracranial pressure, HEM, headache, morning headache, increased by Valsalva and relieved by vomiting, bulging fontanelle under 3, with increased head circumference, cranial sutures are separated, seizure, vomiting, after 3 pseudoappendicitis. Diagnosis, TDM or MRI, and complication, brain herniation, and blindness from the compression of the oculomotor. Treatment. Symptomatic treatment include heightening of the head, mannitol, and treat the cause, removal of a tumor, removal of an hematoma, treatment of an abscess, external ventricular bypass to evacuate the cerebrospinal fluid, plus a probe for taking pressure, normal between 2 to 20 millimeters of mercury. Over 20 millimeters of mercury, hypertension. Avoid lumbar punction because risk of herniation. Over 20 millimeters of mercury, avoid punction because risk of herniation. Scanner or ERM, raise the head and mannitol. Treat may involve surgical placement of cerebral shunt and physiotherapy. Risk of herniation over 20 millimeters of mercury. Thank you for watching this episode of Medicine in 3 minutes. We would like to click the like button and subscribe. Your comments are very welcome. Thank you.